Good afternoon, everyone. I'm Chip Partner, Assistant VP for Communications at the University of Rochester Medical Center. I want to thank our ASL interpreters, Chris and Will, along with Morgan Underwood from ASL Interpreter Services. At UR Medicine, our primary care network has been focused on keeping providers and patients safe while enhancing our ability to treat those with COVID-19. As part of this, primary care has created a dedicated respiratory care clinic to evaluate people who may have COVID-19. By focusing on potentially COVID-positive patients, this clinic is helping to keep primary care practices free to care for people who need other essential health services. Today, we are joined by Dr. Wally Johnson, Director of UR Medicine Primary Care, and Dr. Michelle Cicilline, a primary care physician at Calkins Creek Family Medicine in Henrietta, who sees patients at the respiratory clinic. Dr. Johnson, would you like to open our briefing?
Yes, good afternoon. So just as everywhere in UR Medicine, the goal is to make sure that patients and families know they're safe coming to our facilities. The primary care network has established this dedicated respiratory clinic at Clinton Crossings. The primary care network encompasses 43 practices across 7 counties. And for the last approximately 5 weeks, we have asked all of our practices to send their patients with possible COVID-related symptoms to this central site. At that site, we have a dedicated team that is following the absolute strictest infection prevention protocols. And not only can we therefore test patients at that site, we can also offer them care, because many patients with potential COVID disease, based on the presence of a fever or shortness of breath, actually may have pneumonia, they may have a heart rhythm problem, they may have had a heart attack. And so not only are we offering testing at that site, we're offering care, and that care is coordinated and reported back to the particular primary care office of that patient by the providers like Dr. Cicilline, who are working there that day.
Thank you very much, Dr. Johnson. We're going to unmute and ask if there are any reporters on the line. I'm only seeing TV stations, so I'm not sure if there are a reporter that would like to ask a question, and if not, for our friends at the TV stations, we can ask the questions ourselves. Everyone's unmuted. Any reporter with a question? All right, well, maybe we'll start, Dr. Cicilline, with you. We understand that, or maybe Dr. Johnson, this is your question. Do most patients who come to the clinic test positive for COVID-19?
Interestingly, in spite of the fact that over the last few weeks, almost all the patients have either had a fever or shortness of breath, only about 10% actually test positive for COVID. We're also testing a number of less dramatically ill healthcare workers with relatively minor respiratory symptoms. The goal of testing them is to assure that they can go back to work without possibly bringing COVID disease to their workplace.
So 90% of the patients who fear that they may have COVID disease and have some symptoms, they're coming, they're getting tested, but they're not proving to be COVID positive.
You know, that probably indicates that there's other respiratory viruses active in the community. And again, we are seeing patients who have distinctly non-viral, non-COVID disease, such as bacterial pneumonia. We have sent approximately a dozen patients from our clinic to the hospital. These are people usually whose oxygen levels are low or are having really marked issues with breathing. Happily, in the last week or so, I don't believe more than 1 or 2 patients have been sent to the hospital. Because of the presence of this respiratory clinic, we believe that we've now been able to test approximately 1.5% of our 230,000 plus minus patients within our network. Overall, across our network, patients have been tested at our respiratory clinic and also in urgent care, perhaps in the hospital, perhaps in another hospital, perhaps in the emergency room. The overall rate within our network of positivity is 7.9% of those tested.
And that's testing mostly patients that are symptomatic.
Mostly symptomatic patients, yes.
Dr. Cicilline, I know that the respiratory clinic takes special precautions to make sure patients are safe who do have these respiratory symptoms. Could you maybe talk through from a patient's perspective, what is it like when they show up? What would the patient see, and how do they get care?
So the patient usually had called their primary care doctor before that, and the primary care doctor puts in a referral, and the patient gets a call really quickly within half an hour from the great secretaries at the clinic. And then they say, okay, when you get here, call us. And so from the car, they call and they say, okay, you're going to be room number 8, and we're going to hold up a laminated sign when we're ready for you to come in, so that everyone isn't just coming in at the same point. A lot of things are timed, like if we think you need to take the elevator, for example, we won't have 2 patients in the elevator. And then the patient gets out of the car, one of our medical assistants walks them in with a walkie-talkie and says, I'm bringing up room number 8, and then you're brought right back to the room.
That's great. And actually, a couple of simple questions we should get on the record. What's the exact address of this clinic, and can a patient make an appointment there themselves, or do they have to come through another primary care office?
They can only go through their primary care office, and it's at 2100 South Clinton Road, Building H.
Building H at Clinton Crossings?
Clinton Crossings, yeah.
And if any reporters have joined, you can jump in via chat and let us know you'd like to ask a question. If not, we'll just continue our conversation and ask Dr. Johnson, how does this particular respiratory clinic fit in with the rest of the primary care network and plans to resume elective care across the system?
We're very concerned that patients with non-COVID disease who have chronic illnesses like diabetes and hypertension and heart problems are not seeking the routine care that is generally suggested by either their specialist doctors or their primary care doctors. So part of the goal of having a distinct respiratory clinic is to do to the utmost what we can to assure patients who are coming into their traditional primary care office that they're not going to be sitting in the waiting room with someone who's coughing with a fever. And honestly, I think even as restrictions are lifted and as our offices appropriately following the state and county guidelines begin to do more elective or non-urgent care and begin to return to preventative services and routine physicals, I think we're going to still maintain what's really become the new paradigm of social distancing. And even if the community isn't socially distancing as much, I think there's going to be a natural need to socially distance in physicians' offices in the future, probably indefinitely. I think we are really looking at a redesign of how we run our offices. All of us, Michelle and I, have been doing a lot of video visits with patients. We don't think that's going away. Many patients like the convenience. We're finding that many issues, such as mental health issues, such as anxiety or depression or attention deficit disorder, most of our follow-up visit is in talking with the patient, even when they're with us face-to-face. A detailed physical exam isn't really a huge part of that assessment. So we think that video visits are going to stay with us. We think patients like the convenience. We know that families, particularly in this time of economic stress due to COVID, are going to need themselves to get back to work. We're offering options now through MyChart, our patient portal, for what are called e-visits, where for certain select conditions, which usually have a simple solution like a urinary tract infection, we're now offering visits with an advanced practice partner, a nurse practitioner or a physician assistant. We think that mode of care is going to stay with us forever. We think video visits and telephone calls with patients will become a much more routine part of primary care in the future.
And that's a great transition to Dr. Cicilline. When you're not working at Hawkins Creek Family Medicine and you are working at the respiratory clinic, you're seeing patients who do need to be, they want to see somebody, right? Yeah. They're sick enough that they don't just want to have a video visit. Dr. Johnson mentioned that 90% of the patients that fear they have COVID-19 don't. What are some of the conditions besides bacterial pneumonia, as he mentioned, that you're seeing when you are able to diagnose patients in person there?
I still saw a fair number of strep throat diagnoses, just plain tonsillitis. And then if you wanted to investigate something further, you could call the lab and a phlebotomist would come over and draw blood work for you too. So we ended up able to make really good diagnoses just based on that. But otherwise it was usually just a viral upper respiratory infection.
We know because of COVID-19 and the message Dr. Apostolakis and Dr. Mayo and Dr. Mendoza give, stay at home, stop the spread of disease. Patients are probably worried when they come in that they're going to be spreading the disease. But how do patients feel? What do they say to you about the experience at the clinic?
I know some of them still are scared coming in, but I do try to reassure them that it's really considered a zero contact environment. For example, I'm still able to work in my office the next week around my colleagues and not worry about spreading something. And I'm still able to go home and be with my family and not worry about that. So I've told patients that they find that reassuring. Just the gowning procedures, there's enough PPE there.
That's a great point. Maybe we should explore that for a moment. You talked from a patient's perspective how they get into the clinic. Mm-hmm. What do they see? What are the providers wearing? And even is there a receptionist in the waiting room?
No, there's no waiting room. Okay. That's the thing. So it's a medical assistant in the lobby downstairs and a medical assistant upstairs, and we're all wearing a disposable gown, a mask. I wear a hairnet and a face shield, as well as gloves.
And Dr. Johnson, maybe you could talk about how UR Medicine decided we needed such a clinic and how it was established.
Yes, we had heard that some other healthcare systems across the country had been doing this. We did some quick checking with people we knew in different cities and talked through the basic operation of their clinic. And actually, we started this clinic very quickly. It came to fruition within a week, and I certainly want to thank the staff at Clinton Medical Associates, whose property we're using to do this, for all of their cooperation. Their patients are also being cared for. We have a dedicated space in that building where non-respiratory patients who need to see their usual doctors at that office can see them as well.
And are there lessons that the primary care network is learning from this clinic that we might apply to across the primary care network, or might we have more of these? What are we learning?
Well, I think the clinic has given us an opportunity to learn, as we've discussed earlier, about the prevalence of proven COVID disease in febrile coughing patients. It's perhaps not as high as we would have expected, since really the wave of influenza, the 2019-2020 influenza, really came and went just before COVID really became more prevalent in this area. So we know that there are other respiratory diseases out there other than COVID. I think the big lesson for us as a healthcare system is that we were adaptable enough to make the changes that not only did the right thing medically, but brought the degree of comfort and assurance to patients and families.
Dr. Cicilline, if let's take you to Calkins Creek Family Medicine. If a patient has a problem that's not related to COVID, it's not respiratory, but they feel like they need to be seen, but are worried because of all of the media coverage about COVID, what would you tell them about coming in to see you at Calkins Creek?
Yeah, there's still times when I have to see a patient, and it's a handful of patients a week. But I just try to be very reassuring that our exam rooms are all cleaned. We're going to escort you in. There's no waiting room where you'll be sitting, basically. And just the fact that I'm wearing gloves, a mask, a gown. Well, I don't wear a gown for that.
Yeah.
The face shield. I think that does enough for the patients. Plus, they're my patients, so they know me, and that's a level of comfort in itself.
And have you had any comments from patients after a visit like that? Do they feel less fearful when they see all the precautions that are taken?
Yeah, they're definitely happy with that.
And how far are patients coming to this clinic? As our network stretches across upstate New York.
I believe, Michelle, you'd said you'd had a patient come up from our Hornell practice. Yes. We have practices as far away as Andover, which is between Hornell and Wellsville. We are getting a substantial number of patients from our Livingston and Genesee County practices, from Avon, from Caledonia, from Leroy, from Batavia. If I may just add to something Michelle said, we are just seeing this week probably a handful of our patients face-to-face. The majority of our visits are video. We do some telephone visits for patients that don't have video equipment. And probably 10 or 20% of our visits are face-to-face. Following the guidance of New York State and the easing of restrictions on providing semi-elective or elective or only semi-urgent care, we are going to make a distinct effort to bring in the appropriate primary care patients who need chronic disease follow-up for face-to-face visits over the next couple of months. We're very worried that we can't do everything by video, and we absolutely do believe that it is safe for basically any patient to come into our office right now because of the social distancing and the infection prevention protocols we have in place in our office. We're just literally right now trying to decrease the number of humans in our practice. But we feel that the balance is turning, and there are major concerns about non-COVID illness, possibly even causing more deaths than COVID in some communities because of deferred care. So it's very important for our diabetics to know that they can see us face-to-face if they have a new problem, if they have a sore on their leg, something that is going to be hard to evaluate by video. We're working a lot. I'm sure Michelle and I are doing the same thing day to day, saying, no, you really do need to get your blood work checked so we can monitor the course of your disease. There are people who need imaging tests for follow-up of their cancers. It's very important that these patients know that if they're told by their primary care doctor or their oncologist or their oncologic surgeon they need a scan, that it's safe to do. And the same kind of protocols that we're using in our offices with masks and shields and gloves is being followed across the health system.
That's a great point. Thanks for sharing it. We're going to unmute everybody one more time and find out if there are any reporters that have joined the call that would like to ask a question. And if not, I'm going to ask one more question and then invite Dr. Cicilline, Dr. Johnson to give any closing thoughts they want to share. There's a reporter on the line. Speak now, please. Okay. Dr. Johnson, you shared some interesting data on results of testing. What would you say to patients about where they should get testing? There are a lot of options now in the community, including your medicine urgent care or your own primary care location. So.
If patients have a primary care physician, we would strongly encourage anyone with concerns about COVID disease, first of all, to call their primary care doctor's office. We can arrange typically for a visit or for testing or for some combination. But I think that's the very important first step. We are in primary care there not just to test, but to care, to have a differential diagnosis, to keep an open mind about what might be causing your symptoms. I think that there's tremendous value in what's being done by the state, for example, in some swabbing protocols where people just drive by in their car and get swabbed. My concern is some of those patients may be really sick and don't have a doctor. I would encourage anyone to call the UR Medicine hotline numbers if you want to be established with a primary care physician. we're there to help guide patients and families through this crisis.
Thank you very much. And Dr. Cicilline, I wondered if you had any closing thoughts, just thinking about the patients you care for and haven't been seeing a lot recently. What message would you have for patients generally who are concerned about COVID, but also want life to get back to some semblance of normal and want to re-engage with their physician?
Yeah, I would say we do miss seeing our patients. We want them to know that it's a much better job being able to see patients face to face. When we're ready to open, we're safe. Our offices are safe to come in. And I did want to make a little plug for prevention. Please follow the guidelines and stay home when we're told to. But also in the fall, if everyone could please get the flu shot, or if you need the pneumonia shot now, please get that. Because when we can prevent those kinds of illnesses, the picture is much clearer. We're able to figure out better what's going on.
We should add to your plug on behalf of the Department of Pediatrics that childhood immunizations are essential care and that those need to move forward too, according to the schedule of schools, even when school's not open. So I will add that plug and then ask Dr. Johnson, do you have any closing thoughts before we end our meeting?
No, I would only echo what Michelle says. I miss seeing my patients either face-to-face or without a mask.
All right, well, thank everyone at the TV stations for rolling on this. I'd like to thank Corey White and Jeff Mead, our videographer. Corey is our Zoom Superman, keeps the trains running here. And with that, we will end our meeting. Thanks very much, everybody.